Hey, my name is Dr. Talveer Mandur. I'm a resident physician practicing in Toronto and the co-chair of Healthcare Providers Against Poverty. I am here today in this rally along with community advocates and other experts to really bring attention to the uh, crisis that's happening to the unhoused people in the city, which is really the lack of adequate warming spaces, lack of adequate shelter spaces, which is causing a lot of harm to their health. So we know that 160 people are being turned away every night at central intake, which is the central place where people go to find emergency shelter. So that means those 160 people are not being put in a shelter. They're having to sleep outside, on subway lines, on the grates, in really inappropriate and unsafe places, and that's causing harm. So that's causing increased frostbites, hypothermia, and these people end up in the hospital with these injuries. And really, when people have frostbites, these injuries stay with them for their lifetime, right? So pain and disability and the trauma of that. So what we're really asking for is for the city to listen to the experts, to the evidence-based interventions, that is warming centers. So warming centers right now open at minus 15 degrees Celsius, which is inadequate. Okay. So what we know is evidence shows that most of the injuries, 72% in fact, happen in the moderate cold. So that's below freezing, but above minus 15 degrees Celsius. That means that we're leaving people out on the cold and at risk of these injuries. The risk of hypothermia almost doubles with every 5-degree decrease. So what we need is warming centers to be open through the entire winter. And the Board of Health agrees, right? So they passed a motion saying that we need to have warming centers open through the winter until April 15th. And currently, the city has to vote on this motion, and we hope that they pass that motion, and along with other interventions that are going to be long-term solutions. So things like respite spaces, keeping shelter hotels open, stopping encampment evictions, and building long-term, more affordable housing, and really to invest in community and not in policing, as they're doing right now.